Now, the health department has scrapped contact tracing and some quarantine measures with immediate effect. Contacts of positive cases will now only test if they show COVID-19 symptoms. The Department of Health is scrapping tracing for contacts of confirmed COVID-19 cases, except where infections were picked up in crowded places. And in cases where a person has tested positive, they are still required to isolate for 10 days. Now, to help us unpack this, we are joined by public health medicine expert, Dr. Lehlohonolo Majake. Good morning, doctor, and thank you so much for your time. Let's start off if this really is a good move by the health department. Is it justifiable?
Absolutely. Very good morning and Merry Christmas to her and also to the listeners. It certainly is justifiable, and I think the move that has come now it was going to be an inevitable move in any case. Because when you talk about pandemic management, there are different phases. There's the initial phase where you really need to come up with quick, swift mitigation strategies to immediately curb the problem. And then you continue to monitor the data around in the situation. And then, of course, we are where we are now, where we realize that, look, we've done certain things as part of outbreak response when it was urgent at that moment in time, which entailed, of course, immediate isolation of individuals, and also quarantining because we were worried about the impact that it would have generally on the population based on what we had seen when we had COVID initially with the very first waves. But of course, we look at data, you analyze, and then you start thinking, the things you're doing and the mitigation strategies that you're actually conducting, are they feasible? Are they still worth it? And remember, when you do health, you don't only look at protecting the individuals from a physical point of view. You also do various health economic strategies and measures where you look at the cost benefit analysis and decide whether or not what you're doing will impact positively or negatively on the entire social system, which we refer to as the social determinants of health. So it certainly is justifiable that we're amending it right now.
Now, we know that this, of course, includes prisons where an inmate or a member of staff tests positive and other spaces where people live in proximity, such as old ages and children's homes. But we've been told that the symptoms for the Omicron variant aren't as severe as previous variants. Now, isn't there a concern that the virus could spread even quicker in such spaces?
I think certainly at this moment in time, the quarantine would apply more to individuals like myself or yourself who aren't really in congregate settings. However, as you've said, prisons and other places where you do certainly have overcrowding. And even though, of course, we've seen that there have been various strategies that the Department of Justice and Correctional Services have put in, screening of wardens and having quarantine units, I think they would actually be looking at other ways in which they would best mitigate ongoing problems. But it's not a blanket approach that we're going to stop all quarantine in all facilities. I think there are certain instances, like, for example, in correctional services, with more congregate setting, which will have to be looked at by those authorities in liaison with the Department of Health.
Now, what is the difference, Doc, between one quarantining and being in isolation?
Okay, so when you are isolated, it's when you have a positive result. In other words, you definitely are confirmed COVID-19 positive. You are nasalized and so forth, and you're being monitored, preferably at home. And of course, you're given a trial of treatment to see if you can actually be treated conservatively or whether or not you need to go to hospital. Quarantine, on the other hand, is if I now am positive and you happen to have had lunch with me, so you've been with me for more than 15 minutes at a time, we had masks off, you most likely could have been then, at risk of getting infected by myself, because we know that COVID-19 is an aerosol disease, generating disease that's spread through air. So then you would have to quarantine. Why would Siho need to quarantine? Because you run the risk of having what we call the incubation phase, which is when you get infected, but you don't know you're getting infected, but you can still pass it on to somebody else. So we need to try and prevent you from infecting other people for a period of time. And of course, if you've passed that period of time of about 7 to 10 days, then you're least likely to have had COVID if you don't have any symptoms still. So we won't test you, and then you'll be free to continue with what you need to do. And I think that's the problem now, is So let's say you are somebody who is in a sector where you need to be physically present to actually get paid. What is happening right now is, from a cost-benefit perspective, we actually are negatively impacting on various people's livelihoods. And that's why when you look at such a strategy, I think it's a fantastic move that's been done by Department of Health and the MAC to say, look, there really isn't much benefit anymore in terms of quarantining, keeping people away from their livelihoods. Let's rather amend this. What I really would like to stress, though, is this does not in any way mean that we are now more relaxed about COVID. I notice people are now saying, oh, thank goodness we won't necessarily have to sanitize in shopping malls, etc. That is absolutely not true, and that's not the case. What we're saying is the additional measures that we take place when we do outbreak investigation and management is being amended. But COVID-19 is still there. It still does mutate. We don't quite know what other variants we're going to have. So you need to still adhere to your non-pharmaceutical measures, which is your masking, your hand sanitizing, your social distancing. All of that does not change. What is changing is just how national is actually managing the pandemic management itself and investigation.
Now, Dr. Majake, as a public health medicine specialist, what are our hospitals looking like with regards to the COVID-19 pandemic? We earlier had a conversation with the Eastern Cape around about 417 staff, medical staff, that have actually contracted the virus. From what you know, how is it looking within our hospitals?
So I think different provinces are going through different phases. As we saw, Gauteng was the initial epicenter, was one, of course, being the most affected. What I can say is, look, at the end of the day, the people who come into hospital are the ones who physiologically could not manage it at home. I think when you compare to the previous waves, we didn't really have as many cases of individuals who needed to be ventilated and so forth. And I think there's various articles that have been written by various colleagues from the MRC as well that actually show that there really was a positive outcome for those who had been vaccinated. So if you're still an anti-vaxxer and you're really doubtful of it, I can tell you for a fact that the individuals who came into hospital that were unvaccinated were only sitting at about 15%. The rest of those that were vaccinated actually managed to go through it quite well. I think from an occupational health and safety perspective, you're absolutely right that most healthcare workers did have it. But again, remember, because of the Sisonke trial, a lot of the healthcare workers were also vaccinated. And so even though they had the Omicron virus, they still managed to actually go through it correctly. So I think what I would really like to emphasize is we shouldn't have mixed messaging where, we're talking about reducing the contact tracing and the quarantining, and then me saying that if you're vaccinated, you're safe, and therefore have a public feeling that they can now continue back to pre-COVID days. COVID is still there, it's still real, and we still need to adhere to the basic principles that we've been discussing all along.
So do you then believe that the country was better prepared for this fourth wave that we're currently experiencing?
I think the science and the infrastructure was there in terms of monitoring the virus itself. We were definitely prepared for that. The response to it, we were prepared for it. I think one thing that really worked in our favor was the way in which South Africans responded to the Omicron virus, in the sense that we were not extremely, sick. I think, obviously, when you look at things like your lockdown levels, we didn't really move down up in the lockdown. And I think that is also a sign of systems that are actually there, that are also plausible and that use science to make decisions. So from that perspective, I think the governing bodies responsible for the decision making were certainly very prepared and acted accordingly. And I think we can see that now with these changes. Of course, had the virus been one that was more virulent and one that would actually cause more harm, as was the case with Delta, we would have most likely had to look at ways of repurposing our health establishments to ensure that, we have less trauma and so forth, so that we can actually manage the situation at hand. But absolutely, I think we're doing a very good job, and I think the leaders around the Omicron and also the COVID-19 management itself are actually doing a fantastic job.
And so you're really just saying that there needs to be a very clear communication around this issue of contact tracing and when people actually need to quarantine?
Absolutely. Communication is key, and I think we need to be very careful as well of having individuals misinterpret what is being said. As I indicated, just because we're not doing contact tracing or quarantine does not mean that we need to move away from the basic non-pharmaceutical measures and strategies that we've been doing right now. And please get vaccinated. That's the most important thing right now.
That was Public Health Medicine Specialist Dr. Lehlohonolo Majake. Thank you so much for your time, Dr. Majake.